patient underwent surgery of right submandibular gland during which right hypoglossal nerve was injured during the procedure, following which patient will present with
Options: A. Deviation of tip of tongue to left side. B. Deviation of tip of tongue to right side. C. Loss of general sensation from posterior 1/3 tongue. D. Loss of taste sensation from anterior 2/3 tongue. The correct answer is option B. Deviation of tip of tongue to right side.
Explanation by Dr. Raj Kohila, MD, Anatomy, Assistant Professor, Government Medical College, Madurai.
What is the option? A, B, C, D? Yes. So, which cranial nerve is this hypoglossal nerve? This is your 12th cranial nerve, right? Hypoglossal nerve is 12th cranial nerve. Now, yes, Dr. Shivam, you're going to tell me what is this hypoglossal nerve? Whether it is motor nerve, whether it is sensory nerve, or whether it is a mixed nerve. Yes, please. Yes, Dr. Shivam, you're right. This hypoglossal nerve, it is going to be 100% motor. Okay? It is not a sensory nerve. It's not a mixed nerve. It's entirely motor, which means that this hypoglossal nerve is going to supply the muscles of the tongue. Right? So what are the options we can rule out of these four? Okay, we can remove option C and D. Now coming to option A and B. Which one do you want to choose? A or B? Yes? Keeping your fingers crossed, you can take something and keep. Yeah, Dr. Shiva. Yes. So now I've put an image showing the muscles of the tongue. Whenever in any question you come across an image, right? What is the very first thing you want to do? You're supposed to do. Look for the bony landmarks, right? In this image, I'm going to show you 4 bones. Okay, can you tell me what is this bone? That is the palate, right? Your hard palate. This is the hard palate. This is your soft palate. Am I right? What is this bone here? The bone of the lower jaw. That's the mandible. And who's going to tell me what is this bone? Over here, covered by all the muscles. Yes, that is the hyoid. Very good, Dr. Shina. This is the hyoid bone, right? And you see one pointed projection here. What is this bone? That is the styloid process of the temporal bone. Okay, so we have identified 4 bones in this image. Now, what is our next task is to identify the muscles. Okay, now what is this I told you? The palate, soft palate. So coming from the soft palate, you can see the tongue here, guys. This is the tongue, right? So coming from the soft palate to the tongue, yes, very good. This is the palatoglossus. Got it right. Superb. Coming from the styloid process to the tongue, what shall we name it? This is the styloglossus, isn't it? From the hyoid to the tongue, what can we name it? Hyoid to the tongue. That is the hyoglossus. Very good. Yes, hyoglossus. Now from mandible to the tongue, what name you're supposed to give it? Yes, anyone? From the mandible to the tongue. So on the mandible, inner surface of the mandible, you get to see these genial tubercles. Yes, Dr. Priya, very good, Dr. Shivam. Inner surface of the mandible, you get to see a superior inferior set of genial tubercles. From the superior genial tubercle, you can see these fibers radiating up towards the tongue, all the way from the tip to the base of the tongue. We are going to label it as, very good, Dr. Priya Shivam, genioglossus. Now, what did we see? This 12th nerve is motor, isn't it? and it is going to supply all the muscles of the tongue, whatever we have seen so far, except one. Can you tell me what it is? What is the muscle of the tongue that is not supplied by the hypoglossal nerve? Very good. Okay. Yes. Please make a note of it. This palatoglossus is not going to be supplied by the hypoglossal nerve. Got it? Okay. Now you are going to tell me, why is this genioglossus muscle called safety muscle of the tongue? Who's going to tell me? Yes. This genioglossus muscle is called safety muscle of the tongue because it helps you to put your tongue out, right? Yeah, it helps you to protrude the tongue out. So why is it called safety muscle? If the tongue is not protruded, yes, Dr. Jayasuriyan, yes, the tongue falls back and occludes your respiratory passage. So no other way, you have to call it as the safety muscle of the tongue. Done. Okay, it's going to protrude the tip of the tongue out. Now coming to the concept that I want you to understand. Okay, we'll take image 1, we will move on to 2 and then come to 3. So this is the right half of the tongue. This is left half of the tongue. When my left genioglossus muscle is contracting, what is happening to the tip of the tongue? It's moving to the right or the left? Yes, come on, tell me. When my left genioglossus is contracting, it is pushing the tongue towards the opposite side. Right. Okay. And this one, this is again right and left. When my right genioglossus is contracting, the tip of the tongue is pushed to the left. Isn't it? Yeah, it's pushed to the left. When both the genioglossi muscle are contracting, what is happening as in this picture, image 3? Both the muscle are contracting. The tip of the tongue is kept in the midline. Okay, so that's why when all of us put our tongue out, it's not going to the right or left, but it's in the midline, isn't it? Yes. Okay, now with this concept in your mind, come on, give the answer for this question. Yes, Dr. Jayasuriyan, Dr. Priya, yeah, Dr. Shivam, come on, tell me. So I'll divide this. This is the right half. This is left half. The tip of the tongue is towards the left. Yes, I told you when the right is contracting, it is trying to push towards the left. And when the left is contracting, it is trying to push towards the right, opposite side. So if my right hypoglossal nerve is paralyzed, my right genioglossus will not be able to push it to the left. The tongue, the tip of the tongue will deviate to the paralyzed side, to the ipsilateral side. So if the tip of the tongue is towards the left, then it indicates that there is paralysis of the left genioglossus and the left 12th nerve. Got it? So whether it's an image-based question, a case scenario, or a MCQ type of question, with this concept, you should be able to get out the correct answer. Right? Any doubt in this, you stop me. Okay? Yes. Then in the options, we saw something about the taste, right? So we'll cover that part also. As I told you, one important question, I want you to take 360-degree around that topic. Okay? Yeah. So this is the tongue. As I point out, you can tell me what structure is this. What is this V-shaped sulcus you see in the tongue? It is the sulcus terminalis. Am I right? And what is this opening that you see here? The foramen cecum. Okay, so for nerve supply, for lymphatic drainage, we divide the tongue into 3 parts, right? So whatever lies in front of the sulcus terminalis, what are we going to call it as? Anterior 2/3 of the tongue. And what you see behind the sulcus terminalis, what are you going to call it as? This part? Posterior 1/3 of the tongue. Now, can you tell me what is this structure that you see here? It's not tongue, right? What is behind the tongue? This cartilage that you see here, this elastic cartilage that you see here is the, yes, come on. The cartilage, the leaf-shaped cartilage that you see here is the name of the cartilage. the epiglottis. Right? Yes, Dr. Shiva. So the epiglottis and the tongue, they are connected by what bridge? These are the glossoepiglottic fold. So this part is called as the posteriormost part of the tongue. So whether nerve supply or lymphatic drainage, we're dividing it into three parts. Anterior 2/3, posterior 1/3 and posteriormost part. Okay. Now what is present in the anterior 2/3? Can you tell me? The anterior 2/3 has the papilla. What papilla? Yes, all these raised tips. Yeah, these are the filiform doesn't have taste buds, okay? So this is the one with the raised tips, which is pink at the top. Those are the fungiform papilla. Okay? The taste buds are present in the top, and there are blood vessels which give it a pink appearance. If you put your tongue in front of the mirror, you will see a lot of pink dots, right? Those are the fungiform papilla. Okay? And in front, exactly in front of the sulcus terminalis, you can make out these circles here. Who is going to tell me what is this papilla? This is the, yes, very good. This is the circumvallate papilla, which has the taste buds at the sides. Okay, very good. Now, who's going to tell me what is this structure in the posterior 1/3? What is this? Yeah, if you see at the posterior most part of, the posterior 1/3 of the tongue, all those things that you see that, yeah, that is the lingual tonsil, lymphatic tissue, the part of the Waldeye's ring, you remember? Yes, the lingual tonsil. And what is that in the posterior most part? This area which I'm going to shade, that depression, yeah, that shallow fossa in the posterior posterior most part. What are we going to name it? It's called the, yes, I want a name for it. This is the vallicula. Is it okay, doctor? Right? Yes. So we'll move on to the next part. Anterior 2/3 has the fungiform papilla with a taste bud, the circumvallate papilla with a taste bud, posterior 1/3 has the lingual tonsil, and the posterior most part has the vallicula. Right. Now, why do we need nerve supply for the tongue? Okay, you told me 12th nerve is supplying the motor. Now the taste sense. Yeah. Thank you, Dr. Shiva. The filiform papilla are numerous, okay? The difference between the filiform and the fungiform, you should know that the filiform has no taste buds, right? The tip of it is keratinized, stratified squamous epithelium. Keratinized, stratified squamous epithelium. It just gives a grainy appearance to the tongue, okay? Yeah, like the sand particles. The fungiform has taste buds. Right, Dr. Shiva? Okay. Yes, Dr. Priya, you're right. So when I say sensation, what do you mean by sensation? It could be a general sensation or a taste sensation. So how many of you had coffee in the evening? Yes, Dr. Jayasurya, you would have felt the hot, right? So general sensation includes pain, temperature, touch. What do I mean by taste sensation? Yeah, I like ice cream, I like a spicy biryani, everything, right? The different taste. Yeah, that is the taste sensation. Now, we have to learn the nerve supply of the tongue in three different columns. So just now we saw anterior 2/3, posterior 1/3, and the posterior most part. While learning this, you have to take one thing for consideration. When you say posterior 1/3, it includes the circumvallate papilla. When I say anterior 2/3, it includes the fungiform papilla. Posterior most, it includes the vallicula. Yes, I can see most of you answering like ahead in the chat box, the nerve supply, right? Okay. Anterior 2/3, what is the nerve carrying general sensation? The lingual nerve, which is a branch of, come on, tell me. It's a branch from the mandibular division of the trigeminal nerve. Yes, Dr. Priya. And taste sensation, chorda tympani. That's a branch of, chorda tympani is a branch of, very good, all of you. Seventh nerve, right? Superb. Posterior one third, along with the circumvallate papillae. Yes, tell me what is the nerve? The nerve of the third arch, the glossopharyngeal nerve. Very good. And the posterior most part, the vallicula. Yes, the general sensation and the taste sensation is by a 10th nerve. Very good. Okay. Yes. Now coming back to our question. Yes. So the loss of taste sensation, can you tell me what nerve is responsible for option D? If the patient is going to lose taste sensation from the anterior two-third of the tongue, that is from your fungiform papillae, it will be, yes, chorda tympani branch of seventh nerve. Loss of general sensation from posterior one-third of the tongue, it's going to be ninth nerve. In our case scenario, we saw that the right hypoglossal nerve was injured. So the tip of the tongue will deviate to the right side. Okay. So option is B. All of you got it right. So what did we learn from this first MCQ? Everything about the muscles of the tongue, genioglossus, its action, paralysis, the tip deviates to the ipsilateral side. Isn't it? Right? And the nerve supply, whether it's general sensation, taste sensation, anterior two-third. Yeah, sure. Okay. So we have learned everything about the nerve supply, including general sensation, taste sensation, motor supply, everything. Right? Okay.